Welcome to this afternoon's live telephone town hall with Chairman Richard Neal, your representative for the 1st District of Massachusetts. My name is Elizabeth, and I will be moderating today's conversation. In a few moments, we will be joined by Chairman Neal and Dr. Mark Keroack, President of Baystate, who will answer your questions about the coronavirus. But before we begin, I will explain what will happen in the next hour. If at any point during today's call you would like to ask Chairman Neal or Dr. Keroack a question, press *3 on your telephone keypad. Again, that's *3. You will continue to hear the town hall until one of the chairman's staff members can assist you. If you do not have a chance to ask your questions during today's call, you can leave a voicemail for Chairman Neal and his staff at the end of the call simply by remaining on the line. Again, if you would like to ask Chairman Neal or Dr. Keroack a question, please press *3 on your telephone keypad now. With that, please welcome Chairman Neal.
Thank you, Elizabeth, and thanks to all of you for joining me this afternoon to discuss the coronavirus and what steps you can take to protect you and your family, and steps the federal government and state officials with local cooperation are taking to keep our community safe. I'm delighted that President of Baystate Health Systems, Dr. Mark Keroack, would join us today. We are reminded that he has a strong background in infectious disease medicine, so he can provide some of the most updated and medically accurate answers to your question. As your representative in Washington, I take this moment very seriously and earnestly, and part of that is to ensure that you and your families and our community remain safe. I want to commend, first of all, many of the healthcare workers throughout Western Massachusetts, the state, and the nation for the work that they've undertaken to help prevent, diagnose, and treat patients impacted by coronavirus. You are on the front lines, and we know that your work is not only highly respected, but our colleagues in the United States Congress certainly join in thanking you. I have been in extensive conversations and talked with Governor Baker and his office, and my colleagues are working to monitor the situation and identify ways to help patients, healthcare workers, and others on the front line. The COVID-19 Command Center, announced by Governor Baker on March 14th, will be led by HHS Secretary Mary Lou Sutters and will bring critical coordination for a unified response. And Massachusetts, as you know, has opened a special enrollment period for people to enroll in health insurance exchanges, which can help provide more health care access for Mass residents. In Congress, I played a very important role, I think, last Thursday evening in developing the bipartisan Families First Coronavirus Response Act that passed the House with lightning speed, Democrats and Republicans voting for the final measure. It involved a series of very carefully coordinated conversations on the phone between myself, Secretary of the Treasury, Mnuchin, and Speaker Pelosi. We went back and forth on Thursday evening, finalized the language for detail on Friday, and early Saturday morning, we passed a very strong measure. And now I hope that the Senate picks it up so that it can quickly get to the President's desk. We know that more needs to be done, but not to miss the point that we were able to offer access to unemployment insurance and paid leave as well as free testing, which is highly important in this discussion. The situation across the country concerning the number of cases is rising. The pattern is, as we know, the most vulnerable are the most susceptible. In addition, hospitals continue to need testing kits to properly diagnose patients. Let me speak for a moment to some of the economic consequences that we intend to undertake and are in the midst of discussing even as we speak. I have had conversations over the last 3 days with former Secretaries of the Treasury, Jack Lew and Bob Rubin, and as recently as this morning, spoke with Janet Yellen. Jason Furman has been part of my conversation as well. These are individuals that have extensive experience in economic policy, and I intend to follow up with Hank Paulson as well. Recall that although this is a very difficult economic period, unlike the events of 2008, which were about financial malfeasance, sophisticated debt obligations, and bad judgments, this is entirely different. This is about an international health crisis that we confront. We believe that the opportunity is here, working with the Federal Reserve Board, and let me draw the distinction as to what the Federal Reserve Board does in moments like this. They oversee monetary policy, largely interest rates, and provide overnight lending to major financial institutions across the country. The flow of credit will be very important to people who need it during this period of time. Some banks have already stepped forward and said that they will grant forbearance for up to a month for interest payments, and I hope that others will follow suit on that as well. In addition, Congress controls and maintains fiscal policy. So the distinction there is that the Federal Reserve Board does monetary policy and Congress does fiscal policy. This is a time that is going to require a massive expenditure and infusion of making sure that cash is in the hands, particularly for middle-income Americans and lower-income Americans, to get by with the day-to-day expenses that they're going to need. This was discussed extensively with Secretary Mnuchin last Thursday night, and I think that we at least reached an agreement on the definition of that challenge. I also believe that this is an opportunity here to require that we get underway with a major infrastructure program, understanding that the immediate problem is going to be making sure that people have the necessary cash to get through the next few weeks. But planning for a major infrastructure initiative now would ensure that once the economy gets back on its feet, that we will be able to grow again, largely based on a necessary expenditure of public dollars for infrastructure. That would include highways, roadways, bridges, airports, railroads, broadband, sewer, and water, and, as I noted, rail. I call that to your attention because in times of national emergencies like this, we have to set aside political differences and try to proceed on the basis of making sure that the policy achievements will come to the aid of all members of the American family. Now, I would like to recognize and thank Dr. Keroack, who, as I noted earlier, has a long history not only of running the largest employer in Western Massachusetts, but an institution of international reputation, and we're all delighted with his presence. He will talk to you specifically about many of the health care issues as you raise questions with him, so you will hear firsthand about the priority of health care, and then, as I spoke previously, to the issues of what we will do next to make sure that the economy gets back on its feet. There are simple things that we can all do. You've heard it, and you're going to hear it again: washing your hands, avoiding touching your face, and avoiding contact with people who are already sick. So I want to turn this back to our moderator, Elizabeth, who will walk us through the final logistics and how we can ask Dr. Keroack or myself questions as we go forward. Elizabeth.
Thank you. A reminder for anyone still joining the call, if you'd like to ask a question, you can simply press *3. Our first question comes from Barbara from Westfield. Barbara, you're live with Dr. Keroack and Chairman Neal.
Thank you so much. I am concerned about the virus itself. I realize that it's an airborne, but also how long is its survival rate on surfaces, and what surfaces are more apt to hold it for a length of time?
Well, thank you for that question, Barbara. It's certainly a very topical one. There have been a couple of very limited studies looking at experimentally putting the virus on plastic, cardboard, metal. It seems to last for several hours, but the concentration of virus declines fairly steadily. So while the virus does last on surfaces for a period of several hours, it's not clear how important that is in terms of transmission. Probably more efficient for the virus is the acquiring it through the spray of a cough or a sneeze or direct hand-to-hand contact with an infected individual who's touched their nose or mouth and then shakes your hand. So we're still learning a lot about that. We can say that frequently touched surfaces are probably worth disinfecting on a periodic basis. We don't yet know how important that is. For the virus influenza, we know that it declines fairly quickly on surfaces, and that's not an important way for it to be passed around.
Our next question comes from Suzanne in Springfield.
Hello. My question has to do with regular blood draws. Every 6 months I get a blood draw. I'm 77 years old, and I get a blood draw. March is one of my months for high cholesterol and pre-diabetic blood sugar. So my question is, am I safer due to my age just foregoing that for the time being, or is it reasonably safe in this environment to go have my blood drawn at a Baystate reference lab that I go to?
Well, thank you for that question. We certainly have done everything we can to have our staff drawing your blood following precautions, but there still may be people you'll encounter in the waiting room. I would say that if indeed you have been under reasonably good control from your cholesterol and sugar these past several checks, you may want to chat with your doctor or provider to see if you could put it off for a few months.
A reminder for everyone just joining, simply press *3 if you have a question. Our next caller is Wayne from West Springfield. Wayne, you're live on the line.
I guess my question is for Congressman Neal. We're one of the most sophisticated countries in the world, and I don't understand why the test kits are not available and why the testing facilities are so limited. For Baystate Medical, I'm sure has the lab capabilities to do this, and to get federal approval seems like we're dragging our feet, and that's causing some of the hysteria that's going on in the grocery stores and so on, because people are just stocking up on stuff and making the situation worse.
Well, we try to use, and it's a good question, we try to use the opportunity in moments like this to provide some confidence to the American people about the nature of the challenge that's in front of us. So, for example, as we've heard from those who supply grocery products, they have pointed out regularly that there is no shortage of food. And indeed, I think that you're right on the previous case. There is a conversation I had yesterday with a mask manufacturer in Lee, Massachusetts, as to how they will be able to provide some of these masks now that will be necessary, and other pieces of equipment. But there is really no book on the shelf for something that suddenly happened 3 weeks ago. And I think that as we sift and sort some of our answers here, we're going to try to get to many of these issues as you've described them. But as you know, part of this is the psychological awareness, and it's how people react to information that's put in front of them. I think that this is one of those moments when I must tell you I defer to the careerists in healthcare. I think that if you want to get a good idea of where we are in this, Dr. Anthony Fauci, who's appearing regularly now on national television and through other technologies, he's the one that you want to pay some attention to. You also want to hear what people at the Centers for Disease Control have to say, and also not to ever miss the point of how important the National Institutes of Health happens to be in this moment. So I think that the reaction of the American people at this time has been solid. And I think that we got off to a bad start because some of the misinformation that was out there at the beginning. And I will tell you that even though there is a far-reaching public responsibility that I have here, that I prefer to defer to the medical experts on this as they give us advice on how to go forward. Thank you for the question. It was very good.
Thank you.
A reminder, if you would like to ask a question, press *3 on your phone. Our next caller is John from Longmeadow. John, you're live on the line. Go ahead.
Is this for me? I'm not sure. This is Dr. Russo, Dr. John Russo. Hello, Congressman. And
hi, Doctor.
And Mark Keroack.
Good morning, John. Nice to hear you.
I do have an interesting question, but which I'm not sure has been addressed at all, because it may not be valid anyway. Has there been, to your knowledge, Mark or Congressman Neal, that any two groups have been looked at in terms of acquiring the virus, namely a group with who have not received the regular flu vaccine this year versus a group that has received the vaccine, looking for the possibility, I'm saying the far possibility, but it would be worth looking at, in my opinion, whether in these two groups there is a significant difference in contracting the virus, which would mean perhaps that the vaccine may be somewhat protective, since viruses, I'm sure, do contain particles or parts of their structure that may be common, namely between the regular flu virus versus the coronavirus. Is there any study, to your knowledge, that has been looked at? It's an informational study that could be done very, very quickly, and would yield results which might have large implications if it is protective at all.
Well, I'm not aware of any particular study on that issue, Dr. Russo. I would not expect that the flu vaccine would give cross-immunity or cross-protection against the coronavirus, because the coronavirus uses a different cell receptor to get into the cell than the flu virus does. And so it would be unlikely that antibodies to that would block the coronavirus. I do know that there are vaccine trials in their early stages, but those, to get a safe and effective vaccine is probably a year or more away. But the specific answer is I've not seen a subgroup analysis along those lines, and it certainly should be easy to do, and it might prove interesting.
Our next caller is Cheryl from Springfield. Cheryl, you're live on the line. Go ahead.
Hello, my question is for Congressman Neal. We have been listening to the president, who has been telling us there is a possibility that they will, through the federal, send out checks. And my question is this: does that also apply to the retirees that are, they depend on their Social Security check?
Yeah, it's a good question, and we're discussing that right now. The question we have before us on getting out cash support, which I think is something that's going to have to be done, is how difficult it is to put together what we would call a cutoff. And that's part of the discussion that we've had. So some of us have been of the position that trying to get the money to people who make under $50,000 a year would probably translate more quickly into economic support than anything else. However, there are others who legitimately think that we have to raise that number. Now, you should know I favor the idea of making sure that Social Security recipients receive a cash infusion as well. The average Social Security benefit is about $16,000 a year. That means that half the people that receive Social Security are receiving less than $16,000 a year. So I am of the opinion that for our senior citizens that there ought to be some cash support as well. I also think that it's important to remember here that the best way to get the economy back on its feet is going to be making sure that those who probably more quickly spend it is the most helpful part of the discussion. So I favor making sure that Social Security recipients would receive an infusion as well.
Our next caller is Nina from Springfield. Nina, you're live on the line. Go ahead.
Hello. This is addressed to the doctor. Everybody talks about the virus. My question is, what is a symptom or the symptoms of you potentially becoming ill? I'm in that category: elderly, diabetic, asthmatic.
Well, it's a great question, Nina. Thank you. This virus is kind of a sneaky one in that it can look like any kind of cold or flu you've ever had. So fevers, chills, cough, stuffy nose, muscle aches, those are all the symptoms that can be signs of an early coronavirus infection, but they're also the same signs of flu and many other viruses, which is why it's so hard for us to find that needle in the haystack of who's got the coronavirus versus all the other viruses that are circulating. So the key thing is, if indeed you get symptoms like that, be in contact with your doctor so they can advise you on whether to come in and get tested or whether to just sort of sit tight with symptomatic kind of treatments.
Another reminder, if you would like to ask a question, press *3. Our next caller is Maxine from Holyoke. Maxine, you're on the line live. Go ahead. Maxine, are you on the line?
Yes, speaking. My question is the virus airborne in the strict technical sense, the way the measles virus is? I've heard conflicting reports.
Yes, I think that's a very subtle point, Maxine, and I appreciate your raising it. The answer to that is no. This virus lives on airborne droplets, which generally fall out of the air and onto surfaces after about 6 feet, which is why you hear so many people talking about staying 6 feet away from people. The measles virus can dry and live on a speck of dust that travels through the air for much longer distances, and therefore it's much more infectious. It does not appear that this virus travels around that way, much more like the flu, which also travels on airborne droplets and doesn't live very long on dried out specks of dust.
Our next caller is Susan from Cheshire. Susan, you're on the line live. Go ahead.
Hi, my question is for Congressman Neal. Congressman Neal, as everyone knows, the elderly population is one of the high-risk population. My husband and I both work part-time. We are both seniors. Our part-time jobs are used to supplement our Social Security. I work 18 hours per week, and I want to know if the unemployment package includes part-timers.
We've discussed that extensively. I favor that, and I think that that's where we would head. I think that we have to address that issue largely because of the fact that, again, the question here is how we make sure that people are able to maintain the current standard of living without interruption, which would cause them to pull back, which then would cause people like them to pull back, which would defeat the overall purpose of making sure that we sustain the individuals like yourselves, as you've described it, with making sure that they have the ends that they need every day to live. So I would favor extending this to a qualified, and I think 18 hours a week, something in that vicinity, makes a good deal of sense. Recall that part of the challenge you always have with unemployment benefits is that the federal government provides a safety net, but the states get to interpret much of that benefit. So the rule of thumb is generally about, in some cases, up to 26 weeks, but some states, they allow only for 20 weeks, and they have other requirements. So while I think Congress is prepared to do as you've described, I also think that it would be up to the states, and I think that Massachusetts would probably view it consistently with the description I've just offered. So thank you.
Another reminder, if you would like to ask a question, simply press *3. Our next caller is Tammy from Pittsfield. Tammy, you're live on the line. Go ahead.
Hi, thank you. This question is for Congressman Neal, and my question is, if this is definitely an international crisis and also affects every state, and why is it that we're going state by state instead of addressing this entire crisis as a nation? It seems like every state has maybe a little bit different terms, and I was wondering why the United States is not having one voice, so everyone's doing the same thing. If you could address that.
That's a great question because, and you've accurately described the problem. The federal government is good at providing the safety net on an overall basis. But as you recall here, that it's only within even the last couple of days that we were notified that this is now extended to all 50 states. And many of the healthcare systems in the country, for the better part of our history, have generally received support from the federal government, but definition from state and local governments. And you can see, I think, that one of the major things that has appeared here for all of us as well is that how unprepared local governments have been for something of this nature. Now, that is not the fault of local government. It's the basis of many of the cutbacks that have taken place in local health care services over a long period of time. So you have people on the front lines who I think have not been adequately provided with what they need. But back to the original point, I think that the Department of Health and Human Services, for example, as a federal and national agency, they provide guidance, but implementation has generally always been from the state governments and implemented at the state and local levels. So it's a good question, and I think in this instance here it calls great attention to changes that might have to be made going forward.
Our next caller is Sue from Springfield. Sue, you're live on the line. Go ahead.
Hi, this message is for the doctor. So I'm wondering, if you do get the virus and you recover, can you get it again?
Well, we do know a fair amount about coronavirus infections because there are a couple of old-fashioned ones that cause the common cold, and people do recover from those, and they are immune to them for a considerable period of time. This new coronavirus, we believe the same will hold true. The coronavirus family, though, do occasionally change their stripes ever so slightly, the same way that flu does from year to year. So it's possible the immunity might not last forever. But I think that people who get an infection can expect to recover and to be immune at least for some extended period of time.
If people are still joining the call, you can ask a question by hitting *3 on your phone. Our next caller is Ruby from Great Barrington. Ruby, go ahead. You're live on the line.
Hi, this is Ruby Chang. I'm a pediatrician from Great Barrington, and I have several questions. Number one is that we're starting to see testing come back, and however, we don't know false positives and false negatives, so it's hard to interpret it. And number two is elective surgeries are being canceled at Baystate for people who have been waiting long periods for it. There's no criteria to what is considered elective, and I find that disturbing. And number three is I need to know what to do with children who are not immunized at all. Do they have an increased risk?
Okay, thank you for those questions, Ruby. The testing is extremely new, and the false positive and false negative rates have not been accurately determined. Generally, tests of the sort of the DNA probe technology that's used for coronavirus have fairly high rates of true positivity, in other words, low rates of false positivity. The false negative rate is not known with precision. We're not going to know that until the test is more well established and you can do extensive studies. With respect to elective surgery, there has been guidance that's put out by the Department of Public Health. We were getting ready to announce a suspension of elective surgery prior to the governor's edict, and so had engaged our chief physicians, including our chief physician of the Children's Hospital, and so they have begun to categorize this, but leaving room for physician judgment in terms of whether somebody's outcome or health status would decline if the surgery was deferred. So really it is the judgment of the surgeon. If the person, had to wait a month, 2 months, 3 months for the surgery, would the outcome be worse? Would their health be worse? If the answer to that is yes, then we're going to go ahead and do it. And then finally, the whole issue of a child who has not been immunized, we know that the attack rate is extremely low for children. It's not zero, but it's relatively low. And I've not seen anything about the disease being more severe or more common in kids who have failed or not yet gotten their usual childhood vaccines. So that would be another one that's in the unknown column, I'm sorry to say.
Our next caller is Mary from Springfield. Mary, you're live on the line. Go ahead.
Hi, my question is for Congressman Neal. With all the talk of the federal government sending checks to every American adult, and I guess some to children also, I am wondering if Social Security recipients are on that list.
Yes, good question. I indicated that earlier as well, that I favor the idea of putting some cash into the hands of Social Security recipients. I just would repeat what I said earlier, that Social Security recipients, the average benefit is about $16,000 a year. And you have 10,000 baby boomers that are now retiring every day across America. And I think that recall that Social Security was always supposed to be supplemental income. But I do believe that as we proceed, that there ought to be a support system here for Social Security recipients as well. And I think even for those in the retirement community, the difficulty is going to be at the higher end when we try to determine what a cutoff is. As you might expect, that will be arbitrary. And there will be those that will be just above it that I'm sure that will be unhappy. But I don't believe that we should be providing a check for $1,000 to people who make $1 million, to be very frank. And I think that this is an opportunity for us to get the money again into the hands of people who will spend it as opposed to in the hands of people who will save it. We need that economic activity, and that will provide a quick source of confidence going forward.
For those of us joining, please hit *3 on your phone if you have a question. Our next caller is Cheryl from Springfield. Cheryl, you're live on the line. Go ahead.
Hello?
Hi.
Yes, this is
Go ahead, Cheryl.
Yeah.
You're
I have
live.
a question. I work for the elderly, and I was told that I have to do all the shopping and everything because they're not supposed to be out of their houses. Is that true? Or is it going to be that way?
Well, I'll defer to the doctor on this one.
Okay, I just need to know because
I'm
a senior myself. I'm 63, so.
Right. And Cheryl, this is one of those ones that's kind of in the gray zone. I was actually talking with Mr. Demore of the Big Y Supermarkets today on this very subject. My feeling is that if the elderly individual is not frail or with chronic illnesses, they should be able to go to the supermarket. It might make sense for them to pick a time when the supermarket is not terribly crowded. But I wouldn't put an absolute prohibition on it at this point. And following good hand washing before and after shopping, and not trying not to touch your hands or mouth, or trying not to touch your face rather, would also be good advice. But I wouldn't put an absolute prohibition on it. I think, on the other hand, if the person is frail, and either a relative or friend could do the shopping for them, that would be a nice gesture and a way of kind of building community at a time when we're supposed to be keeping our distance from each other.
Our next caller is Carrie from Springfield. Carrie, you're live on the line. Go ahead.
This message for Dr. Keroack. My name is Kari, by the way. Actually, following up on the previous caller, I have an elderly parent who I take care of, but I also work on the outside, and I guess my concern is transmitting unwittingly anything that I may have or anyone I might have come into contact with to my parent. My question actually revolves around testing. I understand that the testing capacity is ramping up. Where are we with that regarding rapid testing, and who should get tested?
Well, thank you for that, Kari. It's nice to hear a familiar voice.
I was just going to say the same thing, Mark. That melodious voice, I recognized it.
Recognize your voice, sir. Let me just say a word or two about testing, since the subject did come up before. Shortly after the virus came out, there was an international test by the World Health Organization that was taken up by several dozen countries. Our own Centers for Disease Control, who really has a strong track record here, decided they wanted to build their own, and it was beset by problems from the very beginning. Long turnarounds, some false results, etc. They then released it to the Departments of Public Health, some, including Massachusetts, but because the DPH was receiving a limited number of tests, they were rationing it to either healthcare workers or people who were quite ill. Just in the last week, that situation is changing rapidly. Initially, a national firm called LabCorp and then another national called Quest have come online, usually with a 3 or 4 day turnaround. And there are a couple of other national firms that are coming on. So our ability to test is ramping up very, very quickly. Right now at Baystate, we've tested about 160 individuals over the last few weeks. And we have the ability to test 50 to 100 a day, but we expect that number could go up as high as 200 to 400 in the next few days. Ultimately, we'd like to be able to do the test ourselves in-house because we have that capability. So the availability of testing determines who you ought to test. If you're restricted in your numbers, then you sort of would first prioritize your healthcare workforce, who are essential, or those who are really quite ill who might need to come into the hospital. If you had more available tests, you'd like to take care of or you'd like to test anybody who had any respiratory symptoms whatsoever, a mild cold or a mild flu. We hope we're going to get there. As soon as tests become available, we're going to be opening a number of drive-in centers in each of the regions that we serve, so people with mild symptoms can be tested. But we're probably a few days to maybe even a couple of weeks away from being able to do that because of the availability of tests.
Our next caller is Linda from South Hadley. Linda, you're on the line. Go ahead.
Hi, this is for both of you. One is the millenniums do not seem to be taking this serious at all. And I think that we need to maybe get entertainment out and let them know how serious it is. They seem to think that it's just going to go away, and it's not. And I talk to kids lots of times and tell them, you have parents, you have grandparents that you could give it to. You could be a carrier and not get it yourself. The other is our nurses and doctors are usually working 12-hour shifts, and that's a lot to do. I don't know if you're thinking about maybe cutting them to 8 so they don't get worn out. And there's a lot of retired professionals that would step up if you needed them.
So I'll speak to the first part of the question, and I think that a reminder, everybody needs to take this very seriously. My own critique is that too often in my own time in public life that we've allowed entertainment to seep into the public debate. And I think that there are moments where you do pay attention to the careerists and you pay attention to people who have broad experience in these instances. And I think that the purpose of even this phone call is to reassure people based upon the questions you've asked and the responses that you're about to receive and have received, that this is a time, I think, where we have to point out that there are people who actually do this for a living every single day, and that they have advanced knowledge of how best to proceed. And then you hope that we can convince people of the merit of the argument we're making. But this is not about entertainment, and people should be taking this entirely seriously and looking to public officials for accurate information. Mark?
Yeah, well, you couldn't have said it better, Mr. Chairman. Linda, I think you put your finger on one of the key points, which is that you can carry a lot of virus in your nose and mouth and be infectious even if you don't feel very sick. So it is important to find authoritative information. I would refer you to our website, baystatehealth.org, or you could also look at mass.gov, which for more detailed information. And I would try to stay away from the media outlets that say this is going to blow over quickly, or it's a hoax, or it's no big deal, as well as people offering what seem to be cheap cures or trying to score cheap political points as a result. With respect to the shifts, nurses used to work 8-hour shifts when I was a young doctor. They now almost all work 12-hour shifts, 3 12-hour shifts a week. They seem to prefer it, and when we offer them 8-hour shifts, they're less likely to take them. But we do offer flexible work schedules for people who would prefer to work shorter shifts. I myself would be happy if everyone went back to the 8-hour shift approach, but the younger nurses seem to like to work those 12-hour shifts that give them more days off, I guess. In any event, we're trying to make our work schedules flexible with respect to how people want to work.
If you would like to ask a question, press *3 on your phone. Our next caller is Betty from Feeding Hills. Betty, you're live on the line. Go ahead.
Yeah, hi. My husband and I are in our 60s, and unfortunately, we were traveling last week when everything broke out. And we were in Death Valley, California, and then spent Thursday, Friday, Saturday till our plane took us home from Las Vegas. We were in a few different airports. We used Purell and everything, the wipes and everything. But last night, my husband, who has COPD and emphysema, started with a cough and a headache. And this morning, I took his temp. It was 99.9. I got in touch with the PCP, and their advice right now is to take Mucinex DM as well as Tylenol, and to give it a few days and see what happens. If he gets worse or the temperature goes up, to call back on Friday or maybe over the weekend, I guess. I myself have been feeling under the weather, no fever, just a little bit of congestion. So I've just been lying low. We've been hibernating since we came home Saturday. But with the traveling and being in the airports and being in Las Vegas, I'm a little concerned about it. It could be influenza, it could be a cold. I'm not sure, but what would you advise us to do at this point?
Well, I think you've put your finger on the difficulty of picking the needle out of the haystack, Betty. If you had called me earlier, I would probably have given exactly the same advice that your primary care doctor did, which is take it day by day, follow your temperatures, lie low at home, take symptomatic treatments, and if particularly your husband with his lung disease, if his cough or breathing gets worse or if his fevers get higher, definitely call your primary care doctor back, and I suspect he would have you come in to be checked out. But for right now, what you've told me about his condition is such that I would advise you to sort of take it day by day and lie low for the time being.
Our next caller is Louise from Dalton. Louise, you're live on the line. Go ahead.
Yes, this is Louise from Dalton, and I have a question about people with pets. If you're walking your pet, or if you're in a household where a sick person is, and that person happens to sneeze or cough on top of your pet, can that be transferred? If it is the virus, can that be transferred from a pet's fur to a human?
Well, I take it you're not concerned about your pet's health. That's right, correct? Your pet is not likely to get sick from this virus, but his or her fur would be like any other surface. So if someone coughed on your pet and then you immediately patted it, someone else petted it, I think it's possible you could pick up the virus. So you might want to keep your pet away from sick people.
Our next caller is Tracy from Longmeadow. Tracy, you're live on the line. Go ahead.
Yes, I have a question for the doctor. My daughter just gave birth a week ago, and we are now on our way to New York City to pick her up because her pediatrician suggested she get out of New York City. So I'm just concerned about me transmitting the disease to the baby, or how far away we should stay, or how much separation and for how long.
Well, there is very little information about how frequently the virus might attack little babies. There have been some cases in school-age kids, very few that I've seen reported in very young children. But I think the best advice, regardless of whether it's corona or some other kind of virus, is that if you're experiencing any symptoms, you ought to try to stay away from taking care of a young baby.
Our next caller is Susan from Chicopee. Susan, you're live on the line. Go ahead.
Thank you. My question is for the doctor, but first just thank you, Congressman Neal. I always sleep better at night knowing you're there, especially now. So you're a great advocate for us, and I really appreciate it. Doctor, I wanted to know, what's the prognosis for Baystate? How many ventilators do you have? Are you putting up tents outside? Can you receive a plethora of patients? Just sort of what's the update and status on Baystate? Thank you.
Sure. We have been, I've been blessed with an amazing team of people. Our chief physician is a guy from Walter Reed, an infectious disease specialist who is a researcher on biodefense, and our hospital epidemiologist stood up an Ebola containment unit back in 2014, along with a team that focuses on unusual infections. So they were rocking and rolling back in December, screening people and getting us ready. We basically have 90 rooms right now that could take care of a coronavirus patient. We have canceled elective surgeries, which is open capacity. We're also looking at other potential areas where we could open up new units. We took a unit out of mothballs to set up a 12-bed isolation unit. And we now today have dozens of individuals in the hospital on isolation. The major worry I've got in terms of our readiness is the availability of protective equipment for our staff. We currently have a 10-day supply, but we're scrambling to make sure we can keep up with what is a fairly brisk rate of use of masks and gowns. And it's also the issue of people who are exposed, healthcare workers who are exposed. So we have nearly 200 of our 12,000 employees who are now out on a quarantine because we don't want them to transmit. They've either got a respiratory illness or they've come into contact with somebody and are awaiting the test to come back. All of this will be made much better if we had rapidly available, quick turnaround testing, as well as more plentiful supplies to protect our employees. But we think we're ready, and we have been preparing from the standpoint of policies, procedures, training, and expertise to deal with a very large number of people, and that is what we're expecting.
Our next caller is Edward from Springfield. Edward, you're live on the line. Go ahead.
Good afternoon, gentlemen. I have two questions, one for the good doctor and the other for Congressman Neal. Congressman Neal, the question I have for you is, I understand you're working on a bill where if you are a state employee and you go to retire, that even if you have Social Security from previous employments, you have to give back 2/3 of it. How is that bill following along? I understand Massachusetts is one of the only states where that's...
I'll quickly get to that. There are 8 states that are affected by the description, as you've offered, about the WEP. These were decisions that were made many, many years ago, long before I went to Congress, in fact, about how retirement benefits would be drawn down if you were a state employee. Many states opted for the idea of not paying into the Social Security fund. Instead, they decided that they would embrace the public union approach. And the difficulty is that many of those people still qualify based on having put in the necessary quarters to receive the Social Security benefit. So we've been trying hard to correct that, and it is indeed an earned benefit. They did what they were supposed to do, and I'm trying very hard to get that legislation through the House.
Our next caller is...
I'm sorry, I have another call. Another question.
Sure, for the doctor.
Go ahead.
Yes, for the doctor, please. Doctor, where does the VA stand? Do you have any information as to where the VA is in regards to the testing procedures and how they're handling this crisis?
I'm sorry, I don't. I've kind of been head down getting Baystate ready and working with the other hospital leaders in Western Mass, and I've not been in much communication with the VA. You would have to call them to know for sure.
Our next caller is Barry from Charlton. Barry, you're live on the line. Go ahead.
Thank you very much, and I want to just say that this is a fantastic forum. I've got 2 questions. Why did it take so long for the government to react to this virus when it was clear that a major issue was brewing in China? And then the other question was, are there any thoughts to put any types of restrictions on Wall Street to halt the huge swings in the market, which affects everyone's investments and could affect the economy and everyone for quite some time?
So,
thanks.
Very important question. The second one I'll answer first. One of the problems as we've moved to these more technological advancements in trading has been the creation of algorithms and other opportunities for what is known as kind of high-speed trading. The difficulty is that sometimes that does not take into consideration what's really happening. And as you can see, that has contributed to the wild swings on Wall Street. Now, the other difficulty is here that there have been twice at least where there has been almost an arbitrary moratorium based on trading for a couple of moments or, for an opportunity to get markets sturdied. The difficulty is that I don't think that we want to be able to have the government say that they have to shut down markets on Wall Street. I hope that we will take into consideration this whole idea, though, of these high-speed trades that are being undertaken with great frequency. And it's an algorithm that's developed. There's very little opportunity for human interaction. And the result has been, as you can see, wide swings that have created more turmoil than was necessary. On the first part of it, I think that there are many of us, and I know I talked to Mark early on about this. He said that even when the public was beginning to respond to the challenges, he said to me that this virus is already well on its way. He said that he cited specific examples, and I think that some of the suggestions early on that it could be ignored, that was a terrible miscalculation, because those of us who were on the ground, we knew, based on talking to people like Dr. Keroack, that this could not be ignored, and that I think that there was a confusing signal that was sent, and I hope that we've had time now to not only draw back that conclusion, but to understand that this is an international pandemic. And I'm going to go back to the point that Mark and I both made a few minutes ago. This really is a time where you need people who have stability, and you need people who, in fact, have long careers in this, particularly our medical community. I will cite again not only Dr. Keroack for his very informative presentation, but pay attention to what Anthony Fauci says. Pay attention to what the National Institutes of Health have to say, and pay attention to what the Centers for Disease Control. They're the best in the world. So I think that the confusing signals that came early on were not well met by the evidence. Thank you.
Our next caller is Richard from East Longmeadow. Richard, you're on the line. Go ahead.
Thank you. Firstly, I want to compliment the speakers on their level of expertise. It's very reassuring to have people talking that actually know what they're talking about. My question is for Dr. Keroack, and perhaps it's a little technical, but my understanding is that some recent data suggests that people who have apparently been cured of coronavirus, of COVID-19, continue to shed virus for periods of many days. Are there any data or is there any information that demonstrate whether or not these apparently cured people remain contagious?
I think that there is data that after symptoms disappear, people continue, and presumably the people have mounted an effective immune response, that people will continue to shed virus for several days. I think the longest one, and so the recommendation is that if somebody is a proven case, that they should remain out of circulation on quarantine for 14 days after the cessation of symptoms. It is assumed that people who are shedders are potentially contagious. That's not known for sure, but I think it's a safe assumption.
Our next caller is Tina from Pittsfield. Tina, you're live on the line. Go ahead.
Hi. I just wanted to find out, both my husband and I work in the school system, and if a virus hasn't come to a peak, who would be making the decision on when it would be safe for us to go back to school? And my second question would be masks that you wear. Should you be wearing them outside even if you don't have any symptoms or anything? And what would be a good thing if you have family members coming to visit you? Should you be wearing a mask also?
Well, I can tackle that first one, or the second one first. It's recommended that people who don't have symptoms not wear a mask outside, just to be out and about. And I know it's tempting to do so if you see pictures of people's habits in Korea or Japan, but there's no evidence that that's helpful, and it may even be deleterious in that people who wear masks are more likely to touch their face often, so we tend to discourage that. I can speak to the Springfield school system. That was a decision that was made by the mayor and the superintendent of schools, but there was a fair amount of pressure from the superintendents as a group, and then, of course, they were overruled by the governor, who basically kind of mandated this. And Mr. Chairman, you probably understand a bit more about how those things are done, given that you've been a mayor yourself.
Well, I think that one of the challenges you always have is that you're reacting to the immediacy, what's just in front of you. And I think that that there was a varying degree from school systems across the state, and I think that the governor just determined that it would be universal.
Our next caller is Peggy from Charlton. Peggy, you're live on the line. Go ahead.
Oh, hello.
Hi.
Hi, Peggy.
Oh, I'm sorry. I thought I was on the recording. Are you there?
Yes. We're there. Do you have a question for us?
Oh, yes, I do. I was wondering, with all this money being exchanged at markets and everybody going crazy buying things, if the money is contaminated because of the cost of it. And the other question was, I forgot what it was. But anyways, I'll take the cloth one first.
Well, remember here that there are a series of things right now that you have to do to make sure that money stays in the hands of people who are likely to spend it. The last thing you need is to have the economic system frozen because of the fear that you won't have enough money to get through the essentials of what are necessary. Now, examples. If you are getting ready to file your taxes, the idea is that if you are filing a report that is under $1 million, even if you owe money on your federal taxes, you're going to be granted some forbearance. You should still file your tax forms, but if you owe, you're going to be given up to 90 additional days to pay the money. Now, the reason for that is pretty simple. The reason is that what you want to do is to keep money in the hands of people who need it. And I think that that's a good example of governmental policy that, by the way, because you're dealing with the IRS, it represents great efficiency because the technology allows you to do that pretty quickly. At the same time, let's take into consideration somebody, for example, who works at a 7-Eleven or somebody who works at a bodega. We want to make sure that they have an infusion of money if they get laid off. So we extended last Saturday morning at about 12:30, we extended unemployment benefits. Now, that has a consequence that's twofold. One, it guarantees people with the understanding that they will have some security going forward, which they are likely to, again, use the necessities of life. But secondly, that encourages them to be tested. Now, one of the challenges we have, with, as I've described it here, is if you get people, for example, who are in the economy but can't take a day off because they get paid only by showing up, they are likely to go to work even if they have symptoms. And we want to discourage that. So the idea of expanding some paid leave, the idea of expanding unemployment benefits addresses that very issue of making sure that those very people have economic consequence. And again, if you were to provide just this infusion of money to people at the top of the economic scale, they likely just save it. The idea is to put money in the hands of those at the bottom or in the middle who likely are going to expend it and therefore building some confidence in the system.
Mr. Chairman, if I could take a crack at the second part of that question,
sure.
Which is, is money itself contaminated? Is cash contaminated by the virus? I would treat it like any other surface, and if you're handling a lot of money, you're probably going to want to wash your hands or sanitize your hands on a regular basis because it very much like any other cloth or paper or metal or plastic, the virus can survive at least for a few hours on inanimate surfaces. And certainly if I were taking cash from somebody who themselves had a cold or the flu, who shouldn't be at work because they don't have sick time, I would certainly be worried and be washing my hands.
Well, let me thank all of you for joining us this afternoon. And in particular, let me thank Dr. Keroack for providing answers to your questions about coronavirus. A reminder of how important Baystate Medical Center is to all of us in the region and indeed across the state. But there's still a lot of work that has to be done, and the faster that we can respond, the more we can avoid the most drastic consequences of the pandemic and get both our nation's physical and economic health back on track. Thanks to all of you who listened in so patiently today. And thanks to Mark Keroack.
My pleasure. Thanks for having me, Mr. Chairman, and thanks for setting this up.
Thank you, Mark. Bye-bye.